I'm Dr. Hansen, and today we're going to be talking a little bit about the use of the erbium laser for removing moles and skin lesions such as seborrheic keratosis. What is facial resurfacing? Facial resurfacing is actually the use of a chemical, such as an acid, or using a laser to actually take the top layers of skin off. There's actually two lasers that get used primarily. One is the CO2 laser, and the other one is the erbium laser. The CO2 laser actually tends to cause more heat and more downtime and more prolonged redness with increased risks of actually depigmenting your skin permanently. And then there's the erbium laser. The erbium laser is what's more efficient, which means that it actually produces less heat into the skin, which is less likely to cause pigmentation changes. I really like the erbium laser because we can get excellent results from it. The erbium laser can be used basically from the ear to the ear, the top of the forehead to just underneath the chin. And what we can do is we can get rid of wrinkles. And now when we're talking about getting rid of wrinkles, we're talking about getting rid of wrinkles for years. That's the great benefit to it. You will get some skin tightening, and you may have been on our website and looked to see some of these very nice and beautiful results. Those are actually very common results. And that's what can be done with erbium resurfacing. Now, the difficulties with erbium resurfacing is primarily the downtime. If you use a CO2 laser, you're going to have a few weeks of downtime, and then you're going to actually have quite a bit of redness for a while after that. I did mention something about some of the chemical peels. One of them is actually called a phenol peel. That's the one where you will actually get very nice results. You will get skin tightening from it as well. But the biggest issue is you will very likely end up with pigmentation changes so that your neck and your face look like they're different colors. Great results, but long-term complications, and those complications are permanent. The erbium laser, on the other hand, is going to be much less risk of complications. You're going to have much less risk of pigmentation changes so that your neck and your face actually look the same color. You're also going to have a little bit less downtime. When I do full face resurfacing, I'm going to tell the patients that they're going to have somewhere between 7 to 10 days of social downtime. That means the first few days, it sounds a little weird, but you will have some bleeding and you will have a little bit of oozing and stuff that's going to last for those first few days. The patients are going to maintain petrolatum or Vaseline on their face for generally somewhere between 7 to 10 days. Day 7 to 10, they can actually start applying makeup, and then they actually can go back to work. So most patients, what we'll talk about is they will do it on a Friday, take the next week off of work, and then be back to work on the following Monday. They will be a little bit red at that point, but they can apply makeup. So there's some really great results that we can get with the erbium laser with decreased benefits. That's why it's my favorite. Now, another thing that I quite often hear is patients will tell me that, well, I had a CO2 or I had that laser. And then when I ask them about it, they'll say that they only had 3 or 4 days worth of downtime, which tells me they then did what's called a fractional laser. And the patients quite often are not all that happy with it because they only did one of them. It helped them a little bit, but didn't give them the long-term results that full face resurfacing does. Erbium and CO2 fractional lasers actually are just drilling little holes down into the skin using the exact same lasers, but they're only treating a percentage of the skin, and they're not treating all of the skin. Quite often, they're treating somewhere between 15 to 30% of the skin at a time. And as you can see, treating 15 to 30% of the skin versus treating 100% of the skin is going to get you significantly different results. Another use of the erbium laser is actually removal of spots. People will have those raised spots that they kind of look like somebody chewed a piece of brown gum and stuck it on their skin. Those are quite often called seborrheic keratosis, or SKs. You'll hear those. Some people will have a few of them. Some people even might have hundreds of them. I really like the erbium laser to actually remove those, and we can generally get it down to the point where they look like they never existed. Sometimes if they're really deep, we might end up leaving a little bit of a white spot. And another thing that I really like about it, and we're going to show you some pictures of this, is actually it can be used on the scalp. It can be used on the face, and even on somebody who has a little bit darker pigmentation without causing pigmentation issues. We can basically erase those without any issues. I also quite often use the erbium laser for sometimes those what are called dermal nevus or moles. And we can take those down flat. And the only way to completely remove them is to actually surgically remove them to get rid of them 100%. And that means that you would have a scar. The advantage to the laser is we can take those down, and over time they might decide to grow back, but most of the time they can go away and go away forever without you being able to even see that they were ever there. We've actually had very good results with that over time. The biggest thing that we have to be cautious about is we have to make sure that there's no risk of that ever becoming any form of skin cancer, especially malignant melanoma. We don't want to use it to remove a squamous cell carcinoma, and we do not want to use them to remove basal cell carcinomas or anything that's pre-malignant or possibly going to become malignant, such as malignant melanoma. The reason being is then it starts to put you at risk. And so that's an absolute that we will not treat those. So if you're thinking about doing full face resurfacing, look at our website and you can get some great pictures, and that's generally what you should see. We should be able to get rid of perioral wrinkles. Those means the wrinkles around the mouth. We should be able to get a lot of the ones around the eyes, and you should be able to have excellent results. And if you're interested, please contact us at Laserderm for a free consultation.